Can iridology detect tumours? I'll repeat that again. Can iridology detect tumours? I've had quite a few people ask me that question in the last 30 odd years, right? Now, very important to be very clear about what iridology can do and cannot do, right? Now, the reason why iridology is very powerful is because it's very important to understand this. There's a scientific fact that every single day, right? Every single day, the body, through the spinal column and the nerves that are there in your body, that can send 28,000 signals into your spinal column, up the top all the way to your optic nerve, and then the optic nerve can then send that signal sent by the spinal column or via the spinal column. It can send that signal straight to your iris, to your pupil, and to your sclera, which is the colored part of the eye, the pupil, and the sclera, which is the whites of the eyes. Now, it doesn't matter what race you're in, everybody in the world, any nation, the sclera is white. Mind you, there are changes to the sclera like blown up capillaries, expansion of illnesses and so on, where the sclera changes from white to red or pink or even dark. But that's because of sickness along the way. But usually, most people when they're born have a sclera, which is the whites of the eyes, right? So, to answer the question, can iridology detect tumours? No, you cannot. Iridology doesn't detect the tumours. I've seen many cases where people got tumours and cancers and growth and all that. Now, you cannot detect that and you cannot guarantee that by iridology. However, you can save a lot of people's lives this way. When you take photos, right, if you suspect someone's got a tumour or some sort of cancer or some serious disease, you can look at the iris, you can photograph the iris, which is the white part of the eye, so the coloured part of the eye, and you can also film the sclera, and you can see dark markings, very dark. For example, if you've got blue eye, and you've got a really dark brown marking, for example, in the lung area, right, it would pay you to tell the patient, look, there's something in your lung which is not right, because your lung should be like a brown colour, where it is if you've got brown eyes, but there's a very dark spot at, say, 3 o'clock or 9 o'clock in your eyes, okay, like this, you see. This is your lungs, right lung, and this is your left lung. And if you see a dark spot about here, when a brown eye, very dark, a dunder brown, or a dark brown eye, a dark colour in a blue eye, or a dark colour in a green eye or an hazel eye, well, guess what? You then owe it to your patient to go and see a capable oncologist or a specialist in cancer and tumours to get more specialised tests done, right? Now, I have detected cancer in somebody's eyes, in the lung cancer in Singapore and Malaysia, where the woman has been smoking 40 cigarettes a day for many, many years, and she felt all right, but when I photographed the eyes and I looked at the eyes, I was able to see this very dark patch, like almost the size of about a cent, right, like that, very small. And then in her case, she'd been smoking for about 14 odd years, but this brown, very dark brown mark in an eye, in an hazel eye, guess what? That was the start of a cancer in her right lung. Now, normally, I'll tell you now, cancer takes up to 14 years to manifest. In other words, you can have cancer, you don't know. 1 year goes by, 2 years go by, 5 years go by, you don't know. You feel okay. And all of a sudden, the 14th year, bang, the cancer starts to hit you and you start to feel really tired and exhausted and you're not quite yourself, your brain fog, and that is the actual cancer now manifesting itself. By then it can be very late. So then by that point, you've probably given chemotherapy or radiotherapy or pretty advanced medical type techniques which can cause a lot of havoc whilst it's trying to heal your body, right? But in her case, she was lucky she came to see me at a particular fair, like a health fair. I was able to tell her, look, your right eye's got a really dark brown mark in the lung right here, okay? So she took my advice, went and saw an eye specialist and also a lung specialist, and guess what? The cancer was 3 months old. So we were able to treat the cancer when the cancer was only 3 months old. So she didn't have to wait another 11 or 14 years to get the answer, or to get the result that the cancer was there. We were able to deal with the cancer when it was still small, but it was there. It was like a little seed, and it was about to expand and grow, and eventually she would have had a lung, or both lungs, riddled with cancer. So that's how we discovered a potential cancer or potential tumor. So if you're concerned about that, or if you've got something that you don't feel quite well, don't don't go to any doctor. Come and see us. We'll photograph your eyes and we'll work it through. Okay, and we'll give you some right advice, which treatment to take, and so on and so on and so on. Now, if you like this video, press the button down below. All right, join the channel, Planet Wellness Tube, and then every week we give you 3 new videos which are very, very powerful, up to date. All right, you can also request the 2 books, Best Ways to Treat Diabetes and also psoriasis. Also, you can ask for this book here. That's What Your Eyes Can Reveal About Your Health. And in this one, another booklet, Benefits of Having an Iridology Consultation. Believe me, those 2 alone are worth thousands and thousands of pounds to you, because it can save your life. All right? Get on the channel, Planet Wellness YouTube, request those things, and then you can give us a phone call. We can discuss how we can help you, no matter how you feel or not. We can discuss it with you, no obligation, and then we can suggest you ways to talk to us and meet us and have a consultation, and we can help you with your health. Thank you for listening.